Hello and welcome to this special webinar. Good morning, good afternoon, good evening, wherever you're joining us from. Today we're here to celebrate the Cities Changing Diabetes Partnership and also to launch the next phase under our new name, Cities for Better Health. My name is Joe Jewell and I'm the Director of Cities for Better Health, and it's a great pleasure for us to have you today. I will be hosting you for the proceedings and for a lot of the interesting and exciting conversations that we'll be having today. Thank you so much for joining. A lot of our partners are online, but also stakeholders that we collaborate with around the world. We value the time that you've taken to join us, but we also know that you're here because of the importance that you place on improving the population's health and looking at collaboration as a way to make progress and improve the chances and livelihoods for people around the world. We're also here because we believe cities are an important player, an important lever for change, especially as the population becomes more and more urban. So what unites us here is also the belief that cities are an important part of the pathway forward in making that change for healthier populations. We have a fantastic event ahead of you. I will be guiding you through some of the changes that we'll be making in our strategy moving forward, but we've also invited some of our close partners and also relevant global stakeholders to join us here today to give insights into the value that they place on partnership, but also working together to address shared global health challenges, such as NCDs, obesity, cardiovascular disease, and diabetes. So I'm really looking forward to an informative, dynamic, and hopefully inspiring conversation as we move forward. Of course, one of the reasons we're here today is to celebrate the 10-year anniversary of Cities Changing Diabetes and launch our next phase under Cities for Better Health. And of course, it wouldn't be an anniversary if we didn't have a party. So part of the opportunity of gathering here today is to look back on what we have achieved and how we have grown over the 10 years into a more successful and dynamic partnership, but then also to introduce our new strategy moving forward. If I take us a little bit backwards to 10 years ago, 2014, when the Cities Changing Diabetes Partnership was established, we thought we needed an innovative partnership to actually tackle some of the issues that the world was facing in terms of urban health, but also the particular rise of urban diabetes, which we saw as a particular challenge for us as a company, but also in terms of the stakeholders that we engaged with. So the partnership was established in response to the rise in type 2 diabetes in urban areas, but with a specific challenge to also look at what is driving this, what might the solutions be, and how can we work through local partnerships to make change on the ground. So really what we had was a mission to investigate the underlying determinants of type 2 diabetes, and in effect, we wanted to halt the rise wherever possible. One of our core defining principles was also our social determinants of health lens, where we also wanted to look at why certain populations, particular populations at socioeconomic disadvantage, were having greater risk of developing type 2 diabetes, and what could we do about that in terms of creating a healthier urban environment to close that health gap. So when we kicked off 10 years ago, we were pleased to welcome our first 5 founding cities, which were Tianjin and Shanghai in China, Mexico City in Mexico, Copenhagen here in Denmark, and Houston in the US. Since then, over the past 10 years, the network has flourished, and we have continued to grow to more than 47 cities that we have now in the network today. And of course, underlying our city partnerships is our incredible global and local partners that we work with. We are really proud to be able to work with 300 partners around the world. But we also wanted to take the work beyond insights and evidence and understanding. So increasingly over the past 10 years, we've been putting more and more emphasis on the need to drive change and to develop impactful interventions. So here we've also proud to stand by ourselves and say that we are actually supporting more than 100 interventions around the world. So we want to celebrate the program's remarkable achievement and the transformative power of knowledge sharing, collaboration, and of course, working together with communities. Yet, as we reflect on this journey, we also know that there's an opportunity to do better and to move forward and to adapt. So with our move to Cities for Better Health, we want to also recognize that the global circumstances require more from us. We know that there is a desire to have more and more impact, and so we will be working with that also to evaluate and communicate the lessons learnt. But of course, there are three other points that are really important here. The first is that the global burden of NCDs only continues to get worse, and of that, 80% of NCDs are found in low middle income countries. We also recognize that there are shared modifiable risk factors for NCDs, and so perhaps it requires us to move beyond a disease-specific focus to also work on those shared risk factors that are common across a broader range of diseases. And of course, we need the urgent importance of collaboration. No one stakeholder alone can do this. Of course, governments are in the lead, but we also need to work with civil society, academia, and at times the private sector to make a positive contribution to this agenda. So responding to this changing need, we can have an adaptive approach to ensure that we are driving collectively effective interventions that reach more people who need it the most. I would like to introduce, also on this point, to introduce some of the elements of our new strategy, which is around the fact that we have this broader scope across the chronic disease landscape. Our new name, Cities for Better Health, of course, recognizes this pivotal shape and this shift towards a more holistic approach to improving health and preventing chronic diseases in urban communities. So before I move on to more details about our new strategy and to also move on to a conversation with our exciting panelists, I want to just set the scene with an inspiring video that talks about the problem, but also some of the solutions that we're trying to bring to the table here. So let me first introduce our video, Our City, Our Health.
Think of a big city.
Does it look like this?
Like more than half of the people on Earth.
I live in a big city too, but it looks more like this. I love my city, but it's hard to stay healthy here. People struggle with obesity, diabetes, and heart disease.
Each year, 17 million people die early from chronic diseases.
That often could have been prevented.
One of them could be me.
Me.
Or even me.
What can we do to close this health gap?
What do I dream of?
Being able to bike to school.
Places where you can hang out with friends.
Somewhere to play basketball.
Sidewalks.
Places where you can buy healthier food or learn how to make it yourself. With the right initiatives,
it would cost less than $1 per person per year to save 7 million lives by 2030.
So it's an investment for better now and a better future for all of us, you know.
So I hope you enjoyed that video. We're very proud of it, and we're also very excited about the message that it's sending out to the world. And as you saw in the videos, it really underlines the point that cities possess huge power and influence to make a change on the day-to-day basis for people to live healthier lives. We really believe that cities can become hubs for health promotion. Yet, of course, what needs to change is the environment in which people are living. And of course, as our world becomes more and more urban, we need to focus on how cities can become healthier environments. Because the ability of individuals to lead healthier lives is, of course, to a certain extent and to a certain degree, influenced by the environment in which they live, work, and play. So that already gives us some guidance as to the work that is needed ahead of us if we are to reach our ambition of healthier cities. The ambition of the new Cities for Better Health strategy cuts across three priority areas. The first is really to make a meaningful contribution to fostering greater health equity in cities. The second is to expand primary prevention efforts by driving more of these impactful health prevention and promotion interventions that I mentioned before. And the third piece is to take a targeted approach to really try to close that health gap by addressing the barriers to health for children and populations that are affected by specific vulnerabilities or socioeconomic disadvantage. And the way that we would really like to do this is by focusing in on two key areas that we know are important modifiable risk factors for serious chronic diseases, which is improving opportunities for physical activity and improving access to healthy food. As I mentioned, taking a targeted approach means striving to reach the people who are disproportionately affected by unhealthy surroundings. And in this way, we are actually building upon the legacy of Cities Changing Diabetes. Fundamentally, we remain a partnership that creates healthier environments by placing people at the center of our actions and working with communities. I'm sure many of you joining here today in this conversation can attest to the striking inequities that we see in our cities around the world today. These disparities relate to access to fresh, affordable food, places that are safe to walk or bike, and convenient spaces for physical activity and play. And of course, these inequities lead to different opportunities to make healthier choices, and also therefore different health outcomes. So really, a key message we'd like you to take home today is that health equity is at the core of the Cities for Better Health strategy moving forward. And we will be also focusing on areas where we believe that impact can be greatest in trying to close that health equity gap. So on the one hand, we'll be having an increased focus on children and childhood, because we believe that an early start, a healthy start in life, can really set people on the pathway to success, health, and well-being. But of course, we need to also work with those communities, those populations, as I mentioned, that have increased or higher vulnerabilities from a socioeconomic disadvantage perspective. Moving forward, I want to just give you an insight into two of the key ways in which we'll be working with this topic to actually implement and operationalize our strategy. The first is, as I mentioned, to take this increased focus on childhood obesity prevention. We really believe that intervening early is the best way to prevent obesity and also reduce the risk of serious chronic disease later in life. We also know that if we want to reduce childhood obesity or prevent childhood obesity, we need to act on the unhealthy environments that many children are growing up in today. Coming back to some of our key themes, when we're talking about preventing childhood obesity, we will be designing interventions with communities that focus on physical inactivity and unhealthy food as key risk factors, and where community-level change can make a difference in helping people have healthier dietary and physical activity behaviors. What we are happy to kick off this year, and you'll be getting more details soon, is 6 deep dive childhood obesity prevention interventions in 6 different countries across the world. With these deep dive interventions, we will be hoping to use basically controlled trial-like designs in communities around public health interventions to try and work with local communities to respond to the local environmental drivers of overweight and obesity, to capture insights about what is working, and also share with the world what we know on the ground is effective in promoting healthier behaviors across these 6 sites. Our aim is to improve short and long-term health and well-being, to implement evidence-based interventions that are co-designed with the local communities, that are context-specific, scalable, and that the lessons learned can be shared with our wider network. We know this is very ambitious. We're super excited to kick this off this year, and we will be giving you more information soon and sharing insights with the network and the wider stakeholder community. So do watch this space and come back for more information soon. But we know that the demand within our network is also high to do more. So we will also go beyond those 6 sites, and we will also be setting up what we're calling our accelerator ecosystem. So here we're working with some of the 47 cities within our network to actually drive impactful interventions. We'll be working with the local partnerships to design and leverage existing partnerships to take physical activity and food interventions to the next level. And the way we'll be doing that is to actually bring together our global partners, some of whom you'll be speaking to in a minute, together to provide greater access to technical support, seed funding, idea exchanges, and of course, we'll be capturing the knowledge into insightful case studies that can help advance the agenda more broadly after that. So you've heard a lot from me today already. That's been quite a mouthful about our new strategy. We're very excited about that. Of course, you can read more about it online, and we'll be moving to implement it now. But next, I want to be actually talking to some of our key partners about the value that they see in working on this agenda, and also what they want to do moving forward in terms of collaborating on this agenda with us. We have two panel sessions here. We have one now that I'll be moving on to now, where we have organizations such as GEHL, our partners in Bogota City, the International Sports and Culture Association. We also have BYCS, and we have C40. So I'm very excited to have the colleagues here today. After this panel session, we'll also then have a Q&A session where you have a chance to submit your questions and get them answered. So please do look at the Q&A box in your app that you're using, and you can submit questions and they will be fed through to me live. Following that, we will then, of course, have two additional guests from the World Health Organization, and we'll be asking them about the importance of multi-sectoral action on NCDs and also the role of cities in driving health from their perspective. So thanks so much to all the panelists for being here today. It's really great to have you, and we're so pleased that you are willing to sort of commit to the agenda with us and drive action moving forward. So the first person I'm going to come to is Olivia Flynn, who is from GEHL Architects, and that's a long-standing collaborator of Cities Changing Diabetes and hopefully Cities for Better Health moving forward. The first question for you is really, I mean, I just said GEHL Architects, urban planners. Why are you in this space, and how do urban environments from a built environment perspective influence people's health, and in particular the way in which the food they eat and their physical activity?
Yeah, absolutely. Thanks, Joe, and thanks for having me. And it's a great question. I mean, cities, since the sort of beginning of cities, have always been designed around food. So cities could only ever be developed close to agricultural land or close to a river where you could transport food. And in the Industrial Revolution, that was completely disrupted, right? That was no longer like an essential component of how we design cities. So the way that food impacts cities became a lot more invisible in a lot of ways. And people's relationship to how they get food and how they understand it's grown or how it gets to them was completely disrupted. So these sort of like subtle ways happen in land use planning and zoning of where grocery stores and supermarkets are placed, who lives there, who doesn't live there, who has access to that, where sort of food places are in relation to transit opportunities. But it's also things that happen sort of on the neighborhood scale. So all of these sensory things of like, what do you see when you're walking to work? Are you inundated with fast food ads, or are you presented with fresh food? Do you smell something while you're waiting for the bus? And how do those sort of visual cues influence your food behaviors? So, I mean, it happens at really different scales, right? So this really macro scales of the way we design and plan cities that either make it sort of easier for us to have a system that supports community health and planetary health, but also on this like sort of eye level scale of what are the small nudges in your neighborhood that maybe encourage you to make one food choice over another.
Super. And so part of the collaboration between cities for Better Health moving forward, and GEHL has been on a concept called Foodscapes. And this has been piloted in a number of countries, I think South Africa, Colombia, Mexico, the US, to name a few. And we're getting very good feedback from our partners locally about this concept and how it can help them understand the interaction between the urban food environment and cities. So, I mean, could you just give a brief overview of what that is, the Foodscapes concept, and how it's being used in practice?
Yeah, totally. So I mean, it's something that we have been developing in collaboration with Cities for Better Health, Cities Changing Diabetes. And I think it's a concept that, you know, is not super complex, but it is needed. So a lot of interventions on changing diets and changing behaviors are really focused on individuals and asking people to make a behavior change. But we know individuals face a lot of barriers that are outside of their control, and asking people maybe with certain access to resources or income to make a behavior change is like nearly impossible. But so many preventative health efforts, especially related to food, are focused on that. On the other hand, we have like amazing, important work focused on systematic change and like developing a new kind of food system, which is really needed, but really complicated and takes a lot of time. So the thriving foodscape approach really plays with this idea of like, can the neighborhood be sort of a missing middle to this conversation? Could it be a scale that is large enough to test some interventions that could still impact the health, economic, and sort of well-being outcomes of a city, but small enough that communities can take ownership over it, can implement it without really big amounts of access to resources or time or money, but start to move the needle towards lasting change. So we've been working with a lot of cities in the partner network to do these assessments and sort of understand, like in this context, in Lisbon, for example, what is the relationship between this neighborhood, the way things are designed, what's actually available, what is the food offering, and what are people's everyday behaviors, and how is the way we've designed the urban environment either encouraging or discouraging certain kinds of food behaviors or healthy food behaviors? And can we begin to maybe shift the way it's designed or shift the way things are organized or the programs that are offered to make it just a little bit easier for people to access healthy food that they need?
Super interesting. Could you give us a few more practical insights into some of the key findings from the study, and then also how you use those insights to actually generate ideas and solutions?
Yeah, of course. So I think something, like Joe said, we've done this in a lot of different cities, but really different contexts. But there's some things that come up as consistent across contexts. And I think one of those things is that the public realm is not just sort of a nice to have and something that communities with access to resources should have, but it's actually critical in supporting people's food access. So both in Lisbon and in Bogota, where cost is a really big factor in people feeling like they can access healthy food, the people that we spoke to and surveyed actually identified the combination of issues in accessing healthy food that had to do with the public realm were actually greater than cost. So it actually was an even bigger barrier. And for example, in Philadelphia, the walk from the sort of main transit hub to the grocery store took 5 minutes longer because of the quality of the public realm, because there was broken sidewalks and things like that. And that's for an able-bodied person doing that. So we have, things like that, understanding that the built environment is actually delaying and making it harder for people to make a healthy choice. Another really key thing that we've learned is around transit hubs, that transit hubs are really critical moments for people's food behaviors. So people, it's a time where people make a decision based on what's closest and most convenient for them. So these kind of insights can lead us to things like, okay, well, can we redesign the bus stop actually? Can we redesign the bus stop where there's fresh food already there? Can we have the ads on the bus stop not be advertising fast food, but be showing people how to make something with the food that's available in the market right across the street. So really small changes there. Or if we notice that, this road between the subway and the grocery store is really making it longer, harder for people to get the food that they need, maybe that's priority to bring to the city to say it's actually worth it to invest redesigning this road because it's impacting people's ability to make a healthy choice in their everyday lives. So I think there's a lot of these really small sort of connections between the built environment and food access that don't require necessarily big shifts, but I think when looking with this lens, we can sort of point it out and start to propose some interventions that move the needle towards lasting change, where it might feel like this is something really hard to work with or it's going to take a long time, but a small intervention could start to shift the way that a community is able to sort of develop healthy routines.
Thanks so much, Olivia. I will come back to you later at some point, probably for some questions, but I think now is a good opportunity also to then move to Salome Valencia, who is from the Center of Research and Education on Health in Bogota. And Bogota is one of the cities where we actually did the Thriving Foodscape study and worked in a neighborhood, San Luis Chapinero in Bogota, together with GEHL. Thank you so much for joining. It's great to have you here. Could you put a few words on the work that's happened in Bogota, in that district, and also something that you learned about the process of being part of this and what it meant for the city to be involved in it?
Yeah, first, I would like to give a brief context of Bogota. Bogota has like about 8 million people. And it's one of the largest cities of the Latin America. And we have a characteristic of greatest inequalities. And for me, that's one of the most difficult issues to tackle in Bogota. So the pilot in Bogota was done in a neighborhood called San Luis, which is located in the very close to the downtown, where most of the people is like middle and high income country. But hence the people in San Luis is not with that income. So the pilot first identified with quantitative and qualitative data the behaviors, the food behaviors of people, but also the possibilities, because in Colombia or in Bogota, the possibilities to access to healthy food is very complicated. For example, in 2022, 25% of the population could get only 2 meals per day. That means that 2.5 million people could only get 2 meals. So this pilot shows that we need not only to tackle from the health sector, but only we need to intervene environments. So first they did this analysis, quantitative and qualitative analysis. They did the awareness intervention in high schools, but they also intervened the local areas to promote cheaper, healthy foods, because here in Colombia, some of the healthy foods can be more expensive because of the access. And also we have this problem with secure spaces. So we have very bad perception of public spaces, and we also consider that they are very insecure. So this pilot tackled these things, that prices of the food, that you could get cheaper food that was healthier, that you could get to spaces where you could feel like the spaces were like more secure, and to give awareness to the students of the local school. So I think the main lesson for Bogota government is that we need to tackle the inequalities, not only from the health perspective, but from the other sectors like educational sector.
Super, thanks a lot. And it's great that you also opened your reflections by giving us a little bit of context, because of course one of the key things about working in cities is that no one city is the same, and context is everything, and also understanding the communities in which you're working is super important. So thank you for that, and great overview of what the work that was done there. Could you give us some insights into the impact or early insights in terms of results from the Healthy Food Environment pilot that was done in Bogota? What changes did we start to see? And then I'll ask you a follow-up question in relation to that.
Yeah, first that they promoted like a bigger offer now in the neighborhood of healthier food with lower prices. Now there are more activities, outdoor activities that all the community is engaged. And also there are more activities related to food in the local school, and more options and different options for healthier foods.
Super. And so obviously we've been using the word pilot here. And of course, piloting is a good way to start and to understand, to learn, to test out and try. What is the ambition, or how do you see the path forward to expanding and taking the lessons to the next level in Bogota?
Yeah, we as you might not know, we're now in a government change, and now we have this health model that it was only looking forward to tackle determinants in vulnerable people, and now we are trying to expand our model to all population. And we consider that what I said before, like public health is not only about health tech sector. So this is a perfect example that we can take and we can use to promote healthier spaces for all the city now that we are designing our new health model.
Super. Thanks so much for the insights and taking the time to join us in your, what I imagine is a busy schedule. Shifting gear now from food, which is important, of course, to physical activity. Jakob Schauenberg is here joining us from the International Sports and Culture Association. And we have a shared ambition to get children in particular more active because it's critical for health, but it's also good fun and good for people's well-being. Could you talk a little bit into ISCA's perspective on physical activity, but also the equity angle that comes along with physical activity? You know, what are some of the barriers that some communities that are disadvantaged may face to being physically active?
Sure. And you really point to the right issue here, because we talk about physical activity, we understand it as a concept as adults, but no children talk about physical activity. They talk about play, they talk about movement, they talk about joy. And this space, as important as it is, links to healthy food, links to city and community life. And I think we can do a lot with physical activity programs to make sure that children of all walks of life can actually be part of it. All children love to play, is my position, and we can just do much better in terms of giving them access to that. I think there's three elements to that we like to emphasize. One is the hardware, one is the software, and one is what we call the orgware. So hardware is obvious. It's about the spaces, the places, the parks, the sport facilities. And the software, of course, are the programs and activities that we offer for the children themselves, but also the orgware is important. These are the organizations that try to do more to get more people to move. And it could be in civil society, as you also mentioned, that we can find them. So our member organizations from all over the world are from civil society. They are grassroots sport organizations. They are outdoor recreational activity organizations. They are ready to partner and to do more so that we can get the children to move. And if we really just enable the space and the organizations to support the children, we'll make sure that the equity lens is also appreciated and understood, that we can get all the children to get engaged and addressing it that way.
And we've been collaborating on a number of initiatives, and perhaps you could put a few words to the collaboration and some of the programs that we've been working on, and why you think they've been particularly successful in promoting inclusive and accessible play, physical activity, whatever we want to choose, fun.
Indeed. Yes, we have been very pleased to work on the program called Move for Fun. Now, the name says it all, I guess, but really it's not a dictate on how to deliver programs. It's more a framework, it's a philosophy, it's a way of getting the children involved. And we want to emphasize that it's not to say that to children they must play football all times, or they must play handball. It's really asking the children where they are at the age and the social status they are in. What do they want to do? What would they like to do? And evaluate the programs and activities with them. It can be done in schools, Move for Fun. It can be done in local community settings with local clubs. And we've seen it's been quite successful in getting the children not only to engage in the first time, but sustained and continuing liking those activities because they are listened to and they feedback into the program themselves. So, having tested this now in the UK, in Poland, and in Argentina, we feel very positive about it. The playbook has been developed, and we're pleased to say that we want to do more in more cities as well with the Move for Fun program.
And if there are network partners online listening in who are thinking, I would like to do that, of course, they may have the opportunity to become part of Move for Fun. But are there like 2 or 3 key recommendations or considerations that you would give to them if they're thinking about doing something around fun and play, physical activity?
Indeed, yeah. I would like to start by saying, even though the name of my organization is International Sport and Culture Association, it's not about the sport thing. It's not about the professional competition thing only. Yes, some children like to compete. They love to show what they can do and they love to grow. But it's also about understanding how can we make sure they find the joy, the social aspect in the physical activities. So make sure you tone the activities in a way that's really helpful for the children themselves. That's one key point. Another thing is really work across partnerships. Again, you want to work with schools potentially. You want to look at the municipalities, and if you are a civil society organization, you need to find out also, can we work with private sector or other partners as well? So we've seen the best programs come out of cross-sector partnerships when it comes to moving more children.
Thanks a lot. And I guess cross-sector collaboration, working with different partners, what can they bring to the table is going to be a key theme of this conversation today. Before moving to the next panelist, I'm just going to ask, or give you a reminder to the audience listening in that you can be submitting your questions because we'll be coming through to the question section in a minute. But now I'll move on to Daniela Gutierrez, who is from one of our newest partners, BYCS. And perhaps you may have to give a little bit of background as to what BYCS is as an organization and how we are going to be working together moving forward around making biking a more accessible opportunity and option to be physically active.
Yeah, absolutely. Thank you so much, Joe, for having us. And I think very similar to my colleagues here, I'll be addressing certain points that I guess are equally important. And I'm glad to hear that, we have that in common. So before addressing that question, I maybe would like to ask everyone, of course, you guys and everyone listening, to maybe think about your first memory with the bike. Maybe think about where you were at, who were you with, and most importantly, how you were feeling. And as you remember that, you might be getting a hint of what is it that we do. BYCS it's quite a young but very passionate organization with this sort of firm belief that bicycles have the power to transform our cities, and in consequence, cities will transform the world. And similar to you as well, we see cycling as a tool, right, to really address and to cross-cut many different challenges that our cities and our communities are facing today. And we look at cycling through a focus that we like to call the human infrastructure of cycling, and I'll come back to that in just a second. And we all know too well that cycling has wide-ranging benefits, all over the place, from, the individual level when it comes to health, the community level when it comes to social cohesion, city level, and of course planetary level. But even with that understanding, cities are still struggling to introduce or incorporate cycling, if not as the primary means of transportation, at least as one of the most important ones. And we ask ourselves, why is that happening? And let me just give you a quick example to illustrate this. In 2017 in the Netherlands, the cycling modal share for women was 28% and for men was 26%. At first glance, that's just a great statistic, just to know, more women are cycling than men. But we at BYCS, we really like to ask ourselves, who are those women? What is their age? What is their background? What is their ethnicity? Where is their income? But most importantly, who are all the other women who are not cycling? And why is it not that they are cycling? So many cities all over the world have been inspired by cycling mature, countries like the Netherlands, like Denmark, primarily looking into or trying to import sort of design or planning measures, specifically focusing around the infrastructure provision. And although that is crucial, of course, this sort of build it and they will come logic fails to account for many other things that my colleagues have also mentioned today, which is around perceptions, around behaviors, attitudes towards cycling that really determine a cycling prone urban environment. And this is where the concept of human infrastructure really comes into place. This is a concept that to us serves as a starting point to drive the conversation towards people, as opposed to just talking about the built environment. We think that it's equally important. So just to speak a bit about how we do this, first of all, of course, we rely on this concept. We really ground our work in this, in this concept, examining culture, social norms, that in the way in which humans relate to their urban environments. The second thing is that we really try to develop research to position this concept and to shift the narrative around urban mobility and make more people to understand that, this perspective is quite important. The third thing is that, similar to you, we work with local partners. We have the fortune to coordinate a network of cycling advocates in more than 140 cities all over the world. And what this coordination really serves is to, amplify grassroots cycling advocacy all over the world. That also allows us to do the third thing, which is develop and implement engagement programs to grow inclusive cycling cultures from the bottom up. And when I say inclusive, this is key, because most of our programs are targeted at groups and populations that usually face additional vulnerabilities, such as children, women, and caregivers. And finally, we really engage in knowledge sharing and dissemination, embracing the diverse sources of knowledge. We tend to, try to gather as much knowledge as we can, whether that is from the cycling advocates, from the programs, and we rely on strong and creative communication strategies to translate this knowledge and in order to reach, a bigger audience and different types of audiences, whether that is, the decision makers, the policy makers, or the community members. This is the way in which, Bikes, as a young and passionate organization, really, is trying to work to make cycling more accessible for everyone.
Thanks so much for that. And I think the question that you posed to us about remembering your first memory was very nice. And I mean, maybe I have a bias to think about things from a public health perspective, but I was thinking it was a safe environment for me and an enabling environment as well, one where it was possible. So I think not everybody has that opportunity, which I guess is what you're trying to get at with your work. We are embarking on a new partnership, and we will hopefully be able to come back to colleagues with insights and stories from how we're working this year onwards. But could you just bring to life in some other context where you've worked as Bikes as to what are some of the concrete barriers that you're trying to overcome? I know you've worked in India, Mexico. Perhaps you could bring some stories from that.
Yeah, absolutely. Maybe I can just start by giving a bit of framing. So in order, through our work and through many learnings, we've come to understand that in order for people to take up cycling, first of all, they have to be aware, that cycling is an alternative and it's an option for them. But they also need to identify themselves with cycling. And the reality is that many people around the world, still find owning a car truly aspirational, as a symbol of status, and maybe cycling can be associated with a symbol of poverty. And many places around the world really just don't want to associate themselves with cycling or don't see it as an option. The third thing is that people really need to have the skills, to cycle in busy environments, and that is no small thing. Many people just never had the chance to actually learn, and or they were not allowed to do so even. So maybe they come to a point in time in their age that they're just afraid or embarrassed to do so. So that is also crucial. Also, people just need access to cycles, and we shouldn't underestimate what that means. Many places around the world, just people cannot afford a bicycle. They don't have bike sharing systems. They cannot afford, specialized equipment or just storage for the bicycles, and this is crucial. And lastly, people need to be stimulated to cycle, whether that is because your friends also cycle, whether because your family has a culture around that, or just you have an incentive to choose the bicycle on top of other modes of transportation, whether that is in your job, your school, or whatever. So this is just in general a bit of like what we see as barriers. And I think a great example to illustrate a bit of this is a project that we ran in 2022 and 2023 with the support of the Verna Van Leer Foundation, which is the one that you're referring to, Joe. And we ran 3 pilot projects at a neighborhood level with low-income mothers, specifically trying to address these barriers for care-related journeys. And basically partnered with local NGOs there, providing workshops, trainings, awareness sessions, and making low-income mothers feel connected, identified with, and also providing them with the skills to to cycle around their cities, especially for care-related journeys.
Thanks so much, and excited for the journey ahead. I'll now come to my final panelist in this section, which is Hélène Chartier from C40. And we've been speaking about food and physical activity, but perhaps as an organization, C40 is the one here that takes the highest overview of cities as a whole, with the ambition of promoting green and thriving neighborhoods. So, which is, of course, encompassing everything that is required to make a population healthy, but also sustainable. So perhaps you could talk to us a little bit more about the Green and Thriving Neighborhood Initiative and how it can improve public health, in this case, through livability in cities. Thanks for coming, Hélène.
Yes, thank you very much for inviting me. I think C40 is an organization of mayors who are trying to accelerate climate action. But mayors, they don't have only one agenda. So it's very important for mayors to make sure that every decision they make, it's also improving the quality of life, the healthy environment for the people, the inclusion. So it's very important to have a form of cross-sectoral approach of action. So it was very important for us also to work closest to the citizen, and to develop a form of model of project where we could work with the local community and identify with them, analyzing what is in the neighborhood, what is lacking in the neighborhood, what they need, and to identify with them a form of cross-sectoral action plan to improve the quality of life, to improve the health and create a more healthy environment, but also to accelerate climate action. And we have developed a framework and some tool to really work with the community and to develop actions such as the one that has been mentioned before, so transforming the public realm, so we can foster active mobility. We can also create a form of space where people can meet, can have a form of social life, and it can be a little bit the living room of the cities when children can play, and also increasing nature, which is also very important for mental health, for physical health as well, and also make sure that in each neighborhood they can have access to key amenities that makes their life more easy and agreeable. So it's also a matter of having access to not too expensive and healthy food choice, but also health services. So we have been working with the community to identify all of these important elements in their neighborhood and trying to work on the action plan. We have been developing this program, and it's a very important program within C40 because sometimes we work a little bit in silo, and at this point we were working closest to the citizen to identify with them what they really need. We have now working with 22 pilots across the world, and including Dakar in Senegal, Bogota, who has been definitely a pioneer in this community-led vision, North American city, European cities, Chinese cities, and we are having a forum of cities, more than 50 cities who are working closely together to accelerate this vision. We have been also creating a partnership, especially with Novo, GEHL, urban partners to accelerate this action, and recently with Novo Nordisk, we have been developing a tool that it's called the Healthy Neighborhood Explorer that helps cities to measure the health and climate impact of their urban intervention. So all of these different actions we were discussing, when you are increasing nature, when you are adding a bike lane, when you are transforming the public realm, or creating a new amenities where people can access to good food, how it will impact directly the health and the environment of for the community. So it's a very important tool that we are going to launch in the coming months. But I want to say that this agenda is very an important agenda for Myers, and also a new focus to accelerate climate action.
Super. Thanks so much for that insight. And I mean, you heard in my introductory remarks about the importance for cities for better health moving forward of equity, to make sure that these benefits that we're working with cities to achieve actually benefit those who need it the most and don't actually contribute to widening inequalities. How does C40 work on that topic to ensure that the benefits that come from a green and thriving neighborhood actually reach those who need it the most?
Yeah, again, I think first as a Myers city leaders, it's not possible to work a topic in silo, and it's not possible to develop an agenda that people that are socially unjust. It's not going to be well received, and it's normal. So it's very important that we help Myers to think about all of the holistic vision of their decision, and to make sure they can make the decision that is not only good for the planet but is also socially just. So now we don't speak anymore about climate action, but inclusive climate action, and every decision or project that we are working with the cities for their climate action, we make sure that we help them to measure the social impact for their decision. So it's also very important. If we come back to, for example, the example the neighborhood, the Green and Thriving Neighborhood program, one of the key elements is also how we make sure that the housing option is there. And at the neighborhood scale, we make sure that everyone, different social background, different age and cultural background can also find in the neighborhood a place and a decent place where they can live, and also to make sure that we create space for social cohesion, so where the people can meet, can find. We know that loneliness in cities is also a very important topic, so the mental health in cities is included. So all of this holistic vision of the urban transformation is very important, so we don't only create a better planet, but we also work for the people. And I just want to say, I'm sitting in Paris. I used to work for the mayor of Paris. This is also very important. When we work with mayor, we also need to make sure they can explain to the citizens that the decisions they make is not only good for the planet, but is good for them. And being able to explain how these different sister challenges are coming together. Why, when you create a bike lane, it's not only good for the environment, but it's also good for health. It's also helping to create a more thriving business because you increase footfall and other. This type of holistic approach of the urban transformation is very, very important.
Thanks so much. I'm going to go to some of the questions that are coming in from the Q&A. One of them is relating to other sectors that can contribute to health. They're asking about, for example, health insurers. Are they relevant? That's private sector, but there are other government partners. Jakob, you mentioned as well that the idea that physical activity is super cross-sectoral, and perhaps you've got some ideas around working in a cross-sector setup to achieve health goals.
Sure. Yes, indeed. It's super important to think about what are the drivers for physical activity and actually who owns the agenda. I don't know that anybody owns the responsibility to move people. So we need to think about working a little bit more together here. I would like to say that your example of insurers is an important one because, in fact, in several countries, you see that people that sign up for physical activity classes, fitness schools, etc., they actually can get a reduction in their insurance fee because insurers know well that if they're physically active, their clients, they will have a better health situation. So it's a good example of a win-win situation where you can actually bring people to move a little bit more. And for the children as well, it's obvious that we want to work with schools, we want to work with physical educators, but I think physical activity should be embedded in the whole school day, in the transportation to school, ideally on a bike, in the other lessons where we know that children learn better if they're physically active during the lessons, in the breaks and on the way from school as well. And then, of course, my message is also let's work with local clubs, local sport communities that really want to take these children and give them a space to be active, to socialize and to move together.
Salome, if I could come to you as well on that question about working at the city level. How do you see working, needing to work with, I guess, colleagues in different departments on this agenda, people outside of government who have a say on things that matter to health? Could you give some perspectives on the multi-sector aspect there?
Yeah, I think it's necessary. I think, yes, as health sector, as I said before, it's impossible to tackle all these issues. So now we're working mainly with education. For us is important, and for culture. And I also, plus what I said before, I think it's very important to engage communities and to promote social participation. So plus all the sectors that should be involved, we should get also the insights from the communities.
Super, thanks so much. One of the challenges always that I mentioned also in the introductory remarks was around the need to sort of measure impact and achieving a common understanding of what impact means. Obviously, I think we're all working towards improved health impact, but there's also societal impact and other value that this action could bring. Olivia, could I ask you a little bit from your perspective around how do you measure impact or capture impact and communicate that?
Yeah, I think it's a really really interesting question and something we talk about a lot, because measuring health impact or health equity impact is something that happens over a really long scale of time, right? But how do we know in the interim if interventions are working or are landing with the community is really interesting. So I think we think about sort of like what are the overall like bigger health goals, and then what are behaviors that we can measure in the meantime? So do we see, after this pilot intervention in Bogota, do we see more people walking here? Do we see a difference in the ages that are spending time here? Do we see more people eating healthy food? Can we talk to people and understand how their perception of access to healthy food has changed? I think that's one example of a project that we did together in Philadelphia, working with Phil Abundance, which is a really large food bank, an emergency food distribution. And they had a small team that was focused on like, okay, how do we focus a little bit more on the social determinants of health? And, instead of, doing emergency food distribution only, which is really critical, how do we help people sort of feed themselves over a longer period of time? And they were, when we started sort of at the outset, measuring success in terms of pounds of food delivered every week, which is great in some ways, but also doesn't tell you a lot about people's ability to access healthy food, and do they feel like they have what they need to cook something healthy, or is it challenging to get the food that's being offered to them, this kind of thing. And so I think the team that we were working with totally shifted their metrics to be a lot more qualitative, and that with every time that they were distributing food, doing a questionnaire so they could every week sort of check in to say like, okay, over the course of this year, we've actually seen people's perception of the access they have to healthy food really change, but we've also identified that people are really still lacking resources for what to cook or how to do it in such short time. So I think, yeah, it's a really good question, and I think it's a lot about like how we define success and what that looks like, and then how do we tweak our metrics to understand like what can we measure in the interim to know how we can refine these pilots, these interventions, to then scale up towards the health equity outcomes that we're all striving for.
Great, and I have a very interesting question here as well around, the question is looking back to COVID, but the lessons learned during COVID around the interactions between physical health and mental health. And of course, most of us will have experienced lockdown in some shape or form and understood the pressures that put on us. Thinking about the interactions between physical health and mental health, perhaps, Daniela, you could speak a little bit to, is that part of the work that you do in bikes around the mental health benefits of cycling and being active? And then I'll come to Helen with that question as well from the C40 perspective.
Yeah, absolutely. I think maybe not as explicitly, but definitely understanding like the impacts that cycling or active mobility can have on both physical health, but especially on mental health. And during the pandemic, we saw great examples in cities just coming up with ideas, pop-up bike lanes, trying to get people active, like understanding that maybe at that time it was because, public transportation represented a bit of a hazard. We couldn't be like a lot of people congested in the same, closed space. But either way, I think a couple of cities really realized that it was important not only to, move people around because they still had to, do their errands, check up on relatives, etc., but also just to, get a bit of space and freedom. And I think, yeah, cycling did impact that. And Paris is a great example of how, started during the pandemic, but really end up, taking that huge lesson and now implementing many policies around it. So I think we're still trying to figure out the best way to measure these things. In certain projects, we have, measured a sense of joy or a sense of community or a sense of, cohesion. And these things, of course, have an impact on mental health. But I guess also learning from you guys would be really interesting moving on and see, how we can extrapolate maybe indicators that right now are related to food or just broadly movement and physical activity and get better ways to measure those positive effects in mental health when it comes to active mobility.
Super. And Helen, maybe briefly, you could also give the perspective from C40 on that question.
Yeah, I think during COVID, there is also a lot of citizens who realized that there was a form of inequity. Some of the neighborhood was, they have access to a public space where they could easily, go outside. They have access to amenities that were close to where they live. So, and some of the neighborhood was underserved in that sense. So in that sense, it was very important also to recognize that it was very important to focus on the neighborhood where we needed to create a better urban environment. We know that urban living is the most sustainable way. We don't want people to continue to fuel urban sprawl and everything. But to do that, it is very important also to create an urban environment where people want to raise their children, when they feel that they can have a healthy living. And I think the COVID has been, in that sense, very, very important. And I want also to echo what my colleague just said. I think we have seen a lot of cities to experiment. They had to be innovative in the way they were doing. So, for example, cities like Milan and others have experimented school street. During the COVID, were closing the street close to the school to create more space for children to go outside and everything. And they have done it in a very quick way, as well as bike lane and this type of thing. And now they see that it's also changed a little bit their vision of how they can transform the urban environment closest to the community, but also in a more rapid way through tactical urbanism and everything. So it has also led to a few very interesting transformation that mayors are building on now.
Super. Thanks very much. It's been a very dynamic and interactive panel, and we really appreciate the time that the partners have given for this, because this is, at the end of the day, is about partnership and working for change on the ground. So thank you for the panel for now. We'll be now moving to the next section, which is, of course, interventions and reflections from the World Health Organization, which needs no introduction. The World Health Organization is, of course, certainly so important in setting the agenda and also providing guidance to countries, to cities, to communities about what can be done for health. So we're really grateful to have two representatives from the WHO here. We have Katia de Pino Campos, who is Technical Officer in Partnerships in Geneva headquarters. And we also have Natalie Robel, who is the Head of Urban Health Unit at Geneva. Thank you so much for making the time to join us and to provide some reflections from WHO on the topic of urban health, but also the role of multi-sector action in addressing NCDs. So I'll come to you first, Katia. I know that in the sidelines of the World Health Assembly, which is coming up, you must be very busy. You have an event focused on the prevention of non-communicable diseases, or prevention and control of non-communicable diseases. And you've been developing a compendium report of case studies focused on multi-sectoral action in NCD space. Perhaps you could put a few words to some of the lessons learned from these case studies that might be relevant to the audience, to the organizations here that are interested in sort of cross-sector action on prevention of NCDs here.
Thank you very much, Joe. Can you hear me well?
Perfectly.
Yeah, okay, great. So first of all, congratulations for the 10th anniversary of Cities Changing Diabetes and the launch of the Cities for Better Health. And thanks for inviting us to be here with you today. Regarding to your question, yes, 2 years ago, WHO launched an initiative to identify national and subnational experiences that were implementing multi-sector collaborations for NCD prevention and control. And we were really interested in understanding how multi-sector actions are being or were being implemented at the ground level, at countries and cities and in regions within the countries. So we received 95 experiences from 46 countries, and we developed a global mapping report that is available at the WHO website, mapping the countries and the experience implementing those actions. But we selected 17 experiences, and we developed case studies to really understand in-depth understanding of how the implementation were taking place on the ground. And we have several, we analyzed those case studies, and we have several lessons, key lessons that are important for the perspective of health on this multi-sectoral collaboration. So let me highlight 5 for the purpose of this call today this meeting. First was the importance of establishing and integrating multi-sectoral actions into governance mechanisms, and either formally or informally, but really embedding them in the structure of the government through, for example, national or city coordination mechanism, or even working groups within the government to really facilitate the cooperation among various government sectors for aligning their policies, for aligning their resources, for aligning their programs towards a shared goal. And I think that's key in this understanding of multi-sectoral approaches. Another important element here is what I think my previous panelists already mentioned, the importance of sharing knowledge, sharing data, sharing knowledge and collecting and sharing data, including implementing regular reporting and monitoring of these multi-sector initiatives, because this is not only help ensuring transparency and accountability, but it helps make informed decisions and help developing cross-sector policies, because this is all about cross-sector collaboration, cross-sector policies. Another important element that emerged from the analysis was the importance of exercising leadership. And leadership here is not involving the top high-level government officials, it's the leadership of everyone involved in the multi-sectoral actions, because this is really important to focus the goal of the collaboration and to help shift the mindset of a vertical program, a vertical policy, towards a more collaborative multi-sectoral approach. And with this is also aligned with my next point, which is building trust, because collaboration doesn't help by being forced, right? Doesn't help by being establishing a formalized mechanism, although I mentioned that was very important in the beginning for developing those policies. But building trust and collaboration is so important for moving the agenda forward. And these partners, the stakeholders, should invest in relationship building, should allocate time for coordination, for management, for collaboration, should be adaptable, should be flexible, because we are dealing with different sectors, different agendas, different interests, and different point of view. So the open communication channels here is very important when we develop a multi-sector initiative. And my last point, but not least, is about empowering government sectors. And from the perspective of health, we are talking about beyond health. So how we need to empower other sectors to understand why they need to be involved, to get their buy-in since the beginning of the project, to really engage in multi-sectoral policy development. And this is very relevant in our context, because governments change. There is a lot of turnover of government officials and different government reforms. So we need to constantly continue empowering governments and raise awareness and provide capacity development for governments to be able to sustain, not only implement the actions, but also sustain the multi-sector initiatives. So I think those, in a nutshell, are the key message that I would like to share with you and with the participants today.
Thank you so much. And I'm curious, out of that huge list of case studies that you collected from around the world, were there some examples from cities? And if there weren't any examples from cities, what might be the lessons as applied to cities from that exercise?
Yes, the cities are in place. We have several initiatives from cities and from regions within the cities, national and subnational levels. And we have one particularly interesting actually coming from Colombia, the municipality of Paipa, when they use an information system. And with the information system, they were able to connect with all the different players within the municipality to really develop policies, not only regarding to prevention and control of NCD, but also to look at addressing the social determinants of health of the particular city. And in our experience, Joe, the lessons learned that we are collecting and we collect from this analysis applies to either national levels, city levels, subnational levels, and for different areas of health, not necessarily for the prevention and control of NCDs, but they are very cross-cutting examples and lessons learned that we can apply in our own setting.
Thanks so much, Katja. And now I come to you, Natalie, because obviously your work on urban health is extremely relevant as well to, both of you are doing relevant work to us from different perspectives. But your work on urban health is, of course, relevant to the city's agenda. We've been talking a lot here about inequities and making sure that action at the city level, it addresses those inequities rather than worsens them. And I'm just thinking, feel free to talk about the work that WHO is doing on urban health, but try, if you can, to also provide some reflections about that equity challenge.
Thank you very much, Joe, and thanks for the opportunity for being with you. It's been fascinating to listen to all the contributions and also to see a lot of colleagues and partners with whom we work and have been working for many years. Maybe if I can start just by, highlighting the importance of the inequalities, and apologies if I will throw a couple of figures into the room, but I think it's important because you have started by putting in the emphasis on this huge need that we have to address inequalities. And actually, we are still seeing that in many, many cities, not only of low-income countries, but also in high-income countries, in one and the same city, there are huge discrepancies in the life expectancy depending on where you live in the cities. So this is just giving us, showing us the urgency to act. And when we go and look in low-income countries where cities are growing, urbanization is actually increasing, we see that 350 million children still live in informal settlements. And this obviously is increasing because we have facing refugee populations, internally displaced people who are actually moving into urban areas and are actually exacerbating the issues about inequalities in urban environments and are calling actually for action to address health concerns and health needs of these population groups. So apologies for emphasizing this issue, but with figures, but I think we are really at the core of the discussions. And as you were saying, social and environmental inequalities, they do translate at the urban level. Now, maybe we can flip and see the opportunities that we do have actually to act locally for health. And WHO has been working on this for decades, I would say, but actually has been increasing its work on urban health, work in cities for health in the last couple of years, with the understanding that actually cities are a huge opportunity. Actually, they give an opportunity to address health and global health more broadly. But first of all, because we have heard it from the colleagues before, they're the primary implementers of sectoral policy that actually are impacting health. But also because we have quite a lot of good evidence of what works in urban contexts to actually prevent and promote health. And also because, again, COVID was one example, but we have many more. Cities actually in a position to react quite quickly and actually quite innovatively also to address health needs. So this is really giving the mandate, I would say, to see cities, mayors, local professionals of all different sectors actually as the key drivers of public health interventions. So maybe to look specifically of some of the work that WHO has been doing in this area. And many of you, I'm sure you know, the WHO has been working on healthy cities networks. It's a long-standing approach with a lot of experience and successful achievements. But you also have seen certainly that in the last couple of years, actually, we have been involved in a number of other growing partnership initiatives that are focusing on the involvement of local governments and cities in particular, with also very specific target population groups such as age-friendly cities and communities, but also the Bloomberg Initiative, the Partnership for Healthy Cities that is actually looking at NCDs and injuries, but also Breathe Life that is looking at air pollution and climate change mitigation. So I'm just giving you a couple of examples of initiatives, partnerships that are really building on the exchange between cities and they work with cities to address some of the major health issues, but also to come up with key solutions. So a lot of tools and guidances have been developed to support local action for health. And I don't want to go into too much detail, but maybe just, building on the interventions that colleagues have been making before. One is the role of urban planning, urban and territorial planning. A couple of years ago, WHO has been working with UN Habitat and many partners to come up with a guidance book on how actually to integrate health in urban and territorial planning. But it is just to give you an example that there has been a recognition of the importance of urban development for public health outcomes. And a lot of the work of WHO in collaboration with cities has been going into that direction. And if we want to look at very specific cities or specific examples, colleagues working in the area of air pollution and climate change might know that we have been working with 2 cities, for example, in Ghana, Accra and Kathmandu in Nepal, on what we call an urban health initiative for air pollution and climate change, which really tries to map the stakeholders that are important to impact on urban environments, to build their capacities for an effective engagement, but also to help them use tools that assess health and actually economic impacts of specific sectoral policies to identify alternative scenarios, but then also to make sure that urban leaders are actually engaged in the communication, but also in the tracking of the policies that they're implementing. And there are many more that I could actually mention here that we have been working on. I think that one, maybe to conclude, is because children and adolescents have been highlighted as a major population group. It's indeed very important to make sure that young population groups are part of all the processes within the cities, in particular urban planning measures, that they have a voice in order to shape their public spaces for health and well-being outcomes. And so we are working on a project in a couple of cities in different regions to really engage them into the planning process. And I just want to conclude by saying that, Joe, in the very beginning, you were highlighting, when you were talking about your new strategy, about the need to taking a systemic, almost strategic approach to urban health. And this is really what we are trying to achieve in our urban health work. It's just really to see that when we talk about urban health, we are not only talking about the health of populations working and living in urban environments, but actually we are talking about the interconnectedness of different systems, the economic, the environment, and many more. But also we are talking about a number of different interventions that actually have a large number of benefits. So this is the way that we are shaping our work, and obviously very happy to give more information as we go.
Thank you so much, and we'll be definitely staying in touch, and perhaps we can share some information after this call. Katio, just very briefly, because we're a little short of time, but it'll be great to hear your reflections on how we can scale, replicate, or translate lessons from success stories, because we are a network, we are maintaining a network function, knowledge sharing, and we want to be able to take successes and unpick the why and the how here. And I'm just wondering if you could very briefly give a few perspectives on how we could do that, your advice.
Thanks very much. I think broadly speaking, I think there are 2 ways. First of all, we need to disseminate those lessons learned that we have, right? So the further we get the message, the better we all are in terms of implementing the lessons learned. But with that, we need to develop training. We need to develop capacity, develop initiatives that we can use as lessons learned and then transform in workshops, in webinars, in trainings, in materials that help the government officials to implement and to take into account what we identify as lessons learned. So enhancing negotiation skills, enhancing how to engage with different stakeholders. You mentioned we cannot do this alone. It's a different kind of stakeholders, including private sector, including academic, including government, NGOs, etc. So the interests are different, the risks are there. We need to approach that in a way that we identify the risk properly, we mitigate those risks that we identify, and then we manage those interests among those diverse stakeholders. So it's really about promoting that capacity developing in a continual way.
Thank you so much, and thank you so much to WHO colleagues for taking the time to join us today. Much appreciated, and we will keep you posted on our progress. So I wish you all the best. So with that concludes the panel discussion part of our conversation today. We have one final piece before I say goodbye to you, and that is to introduce our Healthy Cities Challenge. So as I mentioned in the introductory part of the presentation where I introduced the new strategy, I mentioned our deep dives on childhood obesity prevention. I talked about our accelerator ecosystem for working with cities that are in the Cities for Better Health network to drive impactful action, to provide them with technical support. But we also have a third pillar or a third avenue for identifying and building and supporting innovative initiatives, and that is our Healthy Cities Challenge, which this year will be co-hosted with C40. So this is building on successes of previous challenges that we've had. We had a Healthy Food Challenge, which was in partnership with the EAT Foundation. We also had the 2022 Healthy Childhood Challenge, which was with UNICEF. So this year, we're pleased to announce the Healthy Cities Challenge, which is going to be focused on innovative and ready to implement ideas that shape healthy, green, and thriving urban neighborhoods, which is good fit because we're doing that together with C40. This challenge is going to be open to any nonprofit or academic institution worldwide, and winners will receive a grant to implement their project. We think that the challenge represents an excellent opportunity to secure some seed funding for piloting and scaling of exciting ideas that enable more physical activity or make healthy food environments, which is consistent with our new strategy, while adhering, of course, to the principles of the green and thriving neighborhoods that is promoted by C40. So the Innovation Challenge will be launched today, and you'll be able to find more information on citiesforBetterHealth.com to learn more about the challenge and submit your proposals. But I will also now hand over to Hélène from C40 to say a few words about how this initiative fits in with your own ambition and your own strategy to drive green and thriving neighborhoods. Hélène, the floor is yours.
Yeah, thank you. We are very, very happy about this collaboration. We were already collaborating with Novo to accelerate this healthy, green, and thriving neighborhood and urban environment for the cities. We were doing that by developing research together, by developing tools to measure the impact of urban intervention, and by supporting cities to develop their own community projects. So when Novo approached us to develop this healthy challenge, it was really just a way to progress, to go even a step further. Also, I want to say, as I mentioned, C40 is a cities organization, so we are working with Meyer to develop their own project and to work closely with the community. But what was very interesting in this challenge, it was a way to also help to empower cities to develop their own project. And I think this is very, very important to have this type of bottom-up approach where the communities themselves develop their project to improve their own community, their own neighborhood, and to create this healthy, green, and thriving neighborhood. So we are very happy of this collaboration, and we are going to work with all of the cities so they can mobilize their local organization to participate to this challenge. Thank you. Thank you very much, Joe.
Super. We're very excited to have C40 on board for this challenge, and we really are excited to see what ideas are submitted, how we can develop them, and use the process to actually drive some more impactful interventions. So thank you so much, Hélène, for coming along with us on that journey. And please do look out for the information on the website that I mentioned before. So that is almost a wrap on this special webinar that we've organized to celebrate 10 years of Cities Changing Diabetes, but also to introduce our new name, Cities for Better Health, and our new strategy moving forward. It's been brilliant to have so many exciting partners with us today, providing their insights as to how to work on the challenge of urban health and serious chronic diseases, what works, how to contextualize it, how best to engage communities. I really appreciate everybody taking the time to join us today, to celebrate with us, but also to learn about what is in store for the future. And really, of course, we know that this agenda is so large that no one organization or entity can solve it alone. So we all need to be working together on a shared agenda towards healthier, more vibrant cities. We've covered a lot of ground today during this webinar. We've reflected on the Network City achievements, what we can achieve through partnerships. We've looked at the way forward, and we've also understood a few of the things that will be coming from Cities for Better Health in the year ahead and the years to come. Of course, the challenge is significant, but I'm leaving today's webinar feeling positive, motivated, and inspired that we can make a real difference on the ground. And we're excited to see what comes next. And we will be sharing, of course, all the outcomes and insights from our initiatives, and also providing a platform to our local partners, to our global partners, to share also their work, because at the end of the day, we can all learn from each other. Of course, every city in this existing Cities for Better Health network is eligible to become an accelerator, so do motivate locally, do reach out to my team here in headquarters about opportunities that you see, and we can discuss that. We're really excited to work with more of you and to do more impactful work. And of course, a reminder that the Healthy Cities Challenge with C40 is now live. So for organizations that are eligible, please go forward and submit your application. We're really excited to review them. We're going to do our best to continue to foster an environment of knowledge exchange, networking, and idea sharing that is our legacy from Cities Changing Diabetes. But on behalf of everybody working on Cities for Better Health, all our global and local partners, and long-standing network collaborations, thank you for your passion over the last 10 years, your dedication and commitment to this important cause, and we're really excited to be working with you in the future under Cities for Better Health. So thanks very much, and let's continue to work together to inspire change and create cities for better health.